My name is Jimmy. I am the founder of Success Capital Organization, which previously has been a sub-recipient of the Global Fund, working in community health responses. And I think for me, what led to even starting the work that Success Capital does was as a result of when I was in my adolescence, I had experienced sexual assault. And I think for me, what was very glaring is that at that time, my voice was silenced. I couldn't understand, I couldn't process. And it's only almost 6 years later, when my friend was sort of sharing her own experiences with the same perpetrator, that I then realized that I was a survivor. And I think for me, it's just that recognition of not having enough information, that recognition of not understanding who I am, that recognition of not being able to identify and articulate my feelings, my emotions, and my identity. And I think, when I see from the perspective of, activism and, being engaged in my work, it's just recognizing that, almost at every point, regardless of whether it's in the privacy of home, where religion is such a huge factor, and your own kin can basically speak about your death, speak about you not deserving opportunity, you not deserving to be participating in public society, and then more broadly in public, where wherever there's like a police stop, there's always having to take out some form of identity card, and so I think in those instances, that's where it's even more glaring, because you expect that the state will have done something. And so you can imagine about, 5 or 6 months after a landmark decriminalization case, and even after the president speaking about respecting the rule of law, the president at the time, I found myself in a police harassment incident, purely because they, didn't understand and couldn't even figure out. And so I think it was very difficult, even that time, in trying to get accountability and trying to seek some form of legal remedy, some form of justice and accountability from that roadblock where I had over 12 policemen surrounding me. And I think for me at that time, it was very, very difficult to even, recognize how do you strengthen, how do you build a case? How do you, understanding that, the legal fraternity has got their own processes and steps that need to be followed. But it was also very difficult for the police service to be able to respond to queries where we needed evidence, where we needed things that can actually, showcase that there was an actual incident that happened. And so, in as much as that, human rights abuse and violation was erased, it's just a stark reminder about how even my assault was erased, purely because you can't always exercise voice and agency, even when you have that voice and agency, because the law isn't always on your side. And even when it is on your side, the reality is that there's so many systems that are practical and very tangible, that have a material impact in limiting the promotion and respect of human rights for trans and gender diverse people. And so I think for me, it's just sort of recognizing that you can't escape stigma, you can't escape discrimination. And even, when you're in a facility where a health provider will then question and ask, but what were you doing and how were you doing it? And with who? Just purely because of how you present yourself differently. Even if something as simple as trying to certify a copy of your national identity card and them seeing that your national gender marker is not the same. And so I think, there's so many variances, and the reality is that, LGBTI individuals, key populations, don't have the privilege to navigate this world in a way that can be not only just empowering and not just based on survival, but that can't allow us to thrive. And the reality is just recognizing that being othered, recognizing that, not having enough human rights literacy across society means that people will not respect us, means that we will be raised, means that we will not be acknowledged and affirmed within the context of public health, universal health coverage, and the HIV response. A lot of community health work, and this is now working with young LGBTI individuals, people are already very scared of health services, where the immediate thing when someone has a symptom, they turn online. They turn to online groups and they seek assistance, saying that no, they might have certain things, they're not sure, they're presenting certain things that are normal to the bodily autonomy. And so you find that it's very difficult for them to go to the nearest clinic. And with this cutting of resources, the reality is that we're now finding ourselves at odds because we who are supposed to be peer navigators, we who are supposed to be helping, as a conduit for individuals in referral services, now cannot essentially take individuals to a facility that can't be trusted. I mean, I remember, going to one facility and, needing a refill for PrEP. And I remember when people were just sitting there and they were, asking and, weird questions, and all of a sudden, staff coming and you're trying to figure out, like, excuse me, like, what is wrong? Like, is there something I'm not wearing properly? Is there... And so even you yourself forget that, your expression is very different from other individuals. And I think it also becomes very difficult, even just with the screening process, with the fact that we're so boxed, for example, no one will ever think about a trans man needing cervical cancer screening. No one will ever think that you need family planning services for a butch lesbian woman. And so I think these are just some of the, realities that we encounter, and it becomes very, very difficult when you're trying to not only advance and advocate for yourself, because people don't see you as human, people don't see you as a client that has agency and that understands what they're going through. And I think, even in the context of just, GBV, because Botswana has got a high scourge of gender-based violence, when an individual wants to report a case, it becomes very difficult. In fact, I had, I think, 3 different cases that have not been followed through, where I haven't even gotten the dignity of case numbers. And this is even after escalating beyond the station commander to the national headquarters. And so it's really very telling how deeply structural and how a lot of barriers. I don't even want to speak about patriarchy. I don't even want to speak about misogyny or sexism, but the reality is that there's so many significant barriers that impact and compromise the HIV response just as a result of people's biases, as a people's ignorance. And I think even more glaringly, when we're talking about our own health, nurse practitioners, they have knowledge, they have been trained. We've had so many different HIV initiatives, from champions, allies being, invested in interventions around faith-based organizations, collaborations where we're consistently educating and advancing, the integration of health services across the public health system. And still, we're finding so many instances of stigma and discriminatory treatment without any accountability. I think on one end, it's acknowledging the fact that, yes, there has been some change because there have been some elements where people have become a little bit more tolerant, a little bit more accepting. I mean, for example, the inclusion of LGBTI folks, sex workers, intersex folks in the key populations defined in the National Strategic Framework that we have now, the 3rd iteration. And so I think that's a critical standpoint, and even just looking at how, for example, I remember very, very early in my activism in like 2013, 2013, it was very difficult to speak about any issues with regards to LGBTI. And I think as a result of, at the time, there were significant investments, not just in HIV literacy, but also in social behavioral change. So basically around human rights, the human rights-based approach to public health. And so that made sure that at least there were some elements in terms of, helping bureaucrats, technocrats, decision makers, traditional leaders, sort of understand that, there are some of these realities. And the fact that there have been so many collaborative engagements, even when it comes to, for example, going to the AIDS conference that includes states and civil society, people have sort of learned, and it's become a lot more progressive, to a point where in 2018, while same-sex intimacy was still criminalized, during the launch of the 16 Days of Action Against Violence Against Women, it was the first time that a sitting head of state in a criminalized country would acknowledge the fact that there are same-sex relationships. And, for me, that was a game changer. Similarly, in 2018 and 2019, I had managed to secure research permission from the Office of the President, which was unheard of. And so I think it's just sort of recognizing that, from as far back as 2013, when there were very few LGBTI organizations, and when you look now, just even from my own organizations, 3 new organizations emerged. And I think it's a very powerful salient environment. That means that people are actually taking action. People are recognizing that they've got agency and they want to take action and sort of contribute towards ensuring that we're removing human rights barriers to health, human rights barriers to employment and other opportunities. And I think for me, it's very telling that even now the state, would allow, a gender diverse person like myself to chair a whole 3-day meeting on key populations with members of parliament and the executive government in 2022. And so I think for me, it's a mark of huge progress. But I think the reality is, in as much as policy making, in as much as the law can change, we still need to make sure that people are not left behind. We still need to make sure that we strengthen the legislative system in terms of ensuring equality and non-discrimination. Decriminalization does not mean equality. And I think for us, it's just recognizing that there's so much more work that needs to be done. But we must consistently be reminded that successes in strategic litigation, successes in human rights, doesn't necessarily mean that the social implications have been brought along. I think that human rights more broadly is one of the fact that there are established standards, the fact that there are international commitments, the fact that we've got soft laws allows for any form of strategic litigation, so approaching the courts, to either, rely on, persuasion or jurisprudence in other contexts, especially in Commonwealth countries. And that's why we've, seen so many advancements that have been happening in the registration of LGBT organizations or in the, seeking to decriminalize. But also I must note that in Lusophone countries, so Portuguese-speaking countries like Mozambique and Angola, decriminalization was achieved through acts of parliament. And so I think there's lots of lessons to be learned with how variant the different spaces or different jurisdictions are, because also I remember very vividly, when there were, human rights advancements in court, Botswana was quite receptive. There wasn't really much that was challenged at the time. However, in Kenya, there was like huge pushback. And it's very interesting that almost 3-4 years later, when court cases occurred or happened before the Court of Appeal, which is the highest court in the land in Botswana, that's when we started having anti-LGBT protests. So I think it's very telling in that wherever there are human rights advancements, whenever there is a push for human rights of othered and key populations, the reality is that there's always some element of pushback. And I think the reality is, we can see how, for example, Botswana's HIV response has succeeded. I mean, we had not just reached the 90 targets, UNAIDS targets, but we had reached 95. And then it was even better in terms of mother-to-child transmission, where we got, I think it was a silver or a gold tier from the World Health Organization in terms of just the advancements that we had made. And so I think for me, it's very telling that if you invest in the social, legal, and I guess to some extent the health elements, because that was the only way that you could have a conversation on LGBTI folks. You couldn't speak about LGBT people being unemployed. You couldn't speak about LGBT people needing to change their gender markers. The only easy avenue in a criminalized state is through the human rights-based approach to health, because we were losing lives, because health impacts everyone, because key populations are part of the community and society. And so once that understanding was established in society, people then knew. It was very similar even in the COVID-19 pandemic, because lessons had been learned from our HIV response as one of the highest disease burden countries in the world. I mean, we have got over 360,000 people who are estimated to live with HIV from a population of possible 2.3 to 2.6 million. And so it's very, very telling that at the end of the day, without the education that was centered on human rights, that would consistently affirm the dignity and personhood of key populations, I don't think would have made as much successes in the context of health. When people know that a facility is safe, a facility is enabling and accommodative and inclusive, it's much easier for them not to rely on social media, not to rely on their friends who might not be, health practitioners, but to actually go to that facility. And in other instances, we had people who would literally sit with symptoms for a week, because they knew that they would be waiting for a campaign from a community health organization like Success Capital, because that was the only time that they could honestly, truthfully speak without the risk of being misdiagnosed as a result of stigma, without the risk of being, eyeballed by multiple staff members who might not understand and might not be sensitive to their diversity. And so there's a direct link. And that link means that we are saving lives by ensuring the promotion and protection of the human rights of key populations. We've seen it continuously, especially with African governments, where whenever it's time for election, regressive populist narratives always emerge. And we've seen that they need to mobilize those who are consistently in socioeconomic challenges, especially when there's a cost of living crisis. And especially because when politicians don't have or can't answer for the corruption, the lack of service delivery, we know that the turning point is on LGBTI folks. That is always a guarantee. We consistently see it because they have learned from the Musevenis of the world, who have consistently used LGBT folks as an electioneering tool. And so I think it's taking from that element at such a higher level to the point where now what used to be very sporadic, what used to be very ad hoc, and what used to be driven largely by religious right-wing churches that come from the United States, has now filtered socially, has now filtered in institutions because they've registered, has now filtered in the context of professionalization, because now you have professional associations that advocate for very, very regressive and non-human rights-based approaches, where they speak about family values, where they speak about sovereignty, where they speak about morality. And we know consistently whenever there's a conflict, whenever there's a crisis, the litmus is the vulnerable group, the litmus is the targeted marginalized groups. And so I think it's very critical for us to just recognize that it's deeply socialized, that bigotry, judgment, classism is deeply seated in society. And so it becomes very easy when someone has got a very problematic and harmful public statement or approach that essentially demonizes us. And because people are able to take that up, in lieu of calling governments to be accountable, in lieu of asking why they're not receiving the services that government promised, they then realize that this is much easier for us to take up. This is much easier to mobilize. In fact, they're incentivized because now they've got the resources that backs them in terms of not only having the legitimacy of, having the backing of an elected government or the government machinery, but also the legitimacy of harmful cultural norms, the legitimacy of harmful religious beliefs. And so I think it's just a recognition that we're consistently surrounded by these very stigmatized, harmful systems, and that it's very easy if you it's literally like coming with a matchstick, and then they can essentially end up being very violent. They can end up perpetuating hate crimes. They can end up perpetuating various forms of stigma and discrimination. And I think for me, it's just sort of the oxymoron of transphobia or biphobia or any other form of phobia. Because how do you act out and become violent when you are in fear of something? And so I think for me, what has changed in comparison to maybe the early 2000s is the fact that right-wing elements are now very knowledgeable. They know that when they see a rainbow, it might allude to LGBT folks. They know that when we speak about gender equality, we're speaking about gender equality beyond just the binary of man and woman. We're including trans and gender diverse folks. We're including gender non-conforming folks. And so it's not even an issue of ignorance. It's purely an issue of an abuse of power. It's purely an issue of inhumanity. And I think in Nelson Mandela's words, Nelson Mandela spoke about the fact that no human is born to hate another. It is learned. And so all these different systems, all these different ways of socializing and legitimizing hate are essentially now not only emboldened, but they're literally educating the generations that have been and those that are to come to be a lot more hateful, harmful, and violent against LGBTI individuals. It would be disastrous. An exit of the Global Fund would be disastrous. A reduction of the Global Fund would be disastrous. It would cost lives. Just the simple easiest example, the first thing that comes to my mind, every 10 minutes, a woman dies as a result of femicide. We must recognize that the face of HIV at the moment is African women and girls in their diversity. We must recognize that those who bear the brunt, not just of the HIV, but also when you're looking at TB and malaria, is because of the gendered impacts of these epidemics. I think it's very, very important for us to sort of recognize that those who are most impacted, even with emerging issues, whether it's conflict situations, whether it's the impact of a climate crisis, is ultimately women and girls. And this is because women are caregivers. Women have to end up caring for others within the household, if not within the community. And it's very, very important for us to recognize that the Global Fund has a wide-reaching impact, not only because it is key to social participation in the form of country coordinating mechanisms that allow different stakeholders, inclusive of civil society and governments, to be a part of the process and conversation, but also we see it in the glaring way in which government funding can be politicized, where if there isn't any political will to back the human rights-based approach to health or the three epidemics, the reality is that resources will not go there. To give you one simple example, our national review on transition readiness had actually established that the US government was funding HIV research 100% fully. And so it's very, very worrisome if the investments that we need are not going towards, if it's not communities or the infrastructure. We must recognize, other very high reliance issues were in social participation. And so if it were not for the Global Fund, countries that criminalize our communities would not fund or would not channel resources towards key populations. And it's very important because that has been a key mechanism and a best practice for social participation. It has been a best practice for ensuring that we can remove human rights barriers. A lot of storytelling that has happened, especially when we started off as a grassroots organization, we were funded in the human rights removal of human rights program, where we actually documented experiences of key populations, drug users, sex workers, LGBTI individuals, not being able to access services. And that led to even state level documenting and making sure that we're able to ensure that these are part of the conversations whenever we're in technical working groups, whenever we're in community coordinating mechanism structures, or whenever there's any other policy related dialogue, noting the fact that the National AIDS and Health Promotion Agency, which is where which coordinates the HIV response, is sitting at the office of the president. So it's very telling in how the HIV response has not only been critical in making advancements and ensuring equity and saving lives, but more importantly, it has been very, very critical in serving as a best practice in other related issues. It has been very critical in integrating COVID-19 response measures within the HIV framework. It has been very critical in strengthening health systems because those health systems were built off of the back of the HIV response in many developing and middle-income countries. Global health will always be a priority because ultimately, when we talk about wanting to grow the economy, you need a labor force that is healthy. You need a labor force that has longevity. And the fact that we've made advancements, not just human rights advancements in health, but we've made advancements not only in the HIV response and the TB response or the malaria response in saving lives, but we're finding a lot of people, for example, people living with HIV who are living much longer. We're finding that the quality of life is so much better. And so I think when we recognize that a healthy population demographic means a healthy demographic, then we're ensuring that we're not leaving anyone behind to achieve the Sustainable Development Goals. And I think it's very important because a lot of people speak about prioritization, and I understand because we've got so many issues that are occurring. But if the COVID-19 pandemic hasn't taught us, then we must recognize how deeply unequal global health is, how deeply compromised global health security is. And I think ultimately it's recognizing that there's so many social determinants that are impediments to ensuring the health and well-being of the entire population. And so I think for us, it's just recognizing that when you invest in global health systems, you're ensuring that there's resilience, not only just for the labor force, when you're wanting to ensure that your country can be comparatively strong in the context of ensuring GDP, ensuring economic growth, but also in recognizing that we need to make sure that everyone is taken care of. Because ultimately, if a body is not well, if one community, if a breadwinner is not well, then that leaves out additional costs to the community. Social Development Director estimated almost 2% of a country's GDP is attributable to the costs of gender-based violence. So it's not just productivity, it's also about the health practitioners that need to provide services to survivors of GBV. It's also about, all the related costs, the law enforcement, and so many other issues. So I think ultimately, when we talk about strengthening global health, we're talking about ensuring universal health coverage by eliminating out-of-pocket costs, ensuring that there's domestic financing, inclusive of targeting equitable approaches for people in rural areas, imprisoned folks, indigenous groups, LGBTI, sex workers, and drug users. But more glaringly, it makes sure that we're also accommodating so many other elements of health, because we have to be very realistic. In an era of misinformation, disinformation, and so many other determinants where there are technological advancements that can lead to misdiagnosis, that can lead to compromises in public health systems, we do need individuals to have HIV literacy. We do need individuals to have social behavioral change investments that guarantee that people will adopt health-seeking behavior. And I think for us, if we're going to compromise global health, we're compromising economies, we're compromising sustainable development, we're ultimately compromising democracy.
Thank you. And if we imagine in an ideal world that we still have fundings and we still invest global health as it needs, what would be the next challenges you would like to tackle? What would be the next action and priority for you?
I think, for us, it's just sort of recognizing that, grassroots communities, community health response measures or interventions, community-based organizations are the ones that are on the ground. They're the ones that are bearing the brunt. They're the ones who, unfortunately, even in the most ideal of circumstances in terms of resourcing, that receive the least resources. So we're talking about prioritizing localization and not talking about, INGOs that end up registering local chapters in their countries. And so I think for me, it's the equitable approach, because that's what ensures people are not left behind. That's what ensures that we're able to reach each and every person. That ensures the last mile forward. When we think about someone who's in a rural area who is living with HIV, has a disability, and might not necessarily be able to access because they're not employed, and so they don't have the means to travel to a center. When we think about that one individual, we're ensuring that everyone is accommodated. We're ensuring that women and girls in their diversity are accommodated. We're ensuring that key populations are accommodated, because we thought about the most outlier, most marginalized individual who might not necessarily easily access health services. And so I think for us, it's just speaking about ensuring that we've got the equitable means of ensuring that everyone is accommodated, included in public health responses, and that we're able to address some of the social determinants to the three diseases. So how do we ensure that our health systems are resilient for humanitarian conflict and climate situations? How do we ensure that they're resilient even in instances where there might be a lack of funding? But the reality is that at least we can find some measures or means to ensure that concerted efforts around logistics, around ensuring that the value chain isn't compromised, and ensuring that at least ultimately the costs are a little bit lower. And we know for sure that these community-based organizations, these grassroots organizations are operating on minimal funds. I mean, when you think about some of the realities that we experience at Success Capital, operating with less than 500,000 pula, and that can be translated into almost the equivalent of about 38 or 37,000 euros a year. So the reality is that our cost base tends to be much lower, but our impact is not only scalable, our impact is transformative, because we are the same people who are impacted by the issues that our people and the clients that we serve are impacted by. That solidarity is very powerful. In any crisis that the world has experienced, solidarity at a community level, at a national level, and at a global level has always played an instrumental role in changing the trajectory of that crisis. We have seen a time immemorial where people who have been left behind have been brought into the fold or accommodated or included as a result of humanity. And so, in as much as we can have economic arguments, in as much as we can speak about the limitations in terms of resourcing, let us also acknowledge that Africa has been underdeveloped. Africa has been inundated with state debt. Africa has been inundated historically with transatlantic slave trade. And so in the year of the African Union for Justice for Reparations for Africans and people of African descent, I think it's very critical for us to acknowledge that if anything, if we cannot resort to solidarity, can we at least rehabilitate? Can we at least atone and ensure that we're channeling the resources to ensure that the very health systems that we speak about, the very 3 diseases that are compromising global health security, that they can be safeguarded, that they can be resilient beyond, and that ultimately that we achieve leaving no one behind by 2030. I think it's very critical for us to recognize that solidarity is really about our humanity, it's really about our dignity and our personhood as enshrined in the indivisibility and universality of the Universal Declaration on Human Rights. And I think ideally, even if we have different political ideologies, even if we might acknowledge different elements of the spectrum, whether it's within capitalism or socialism, ultimately, we want to respect, promote the sanctity, dignity, personhood of every single individual. And ultimately, we appeal to the international community to not only ensure the promotion and respect for human rights, but to save the lives by continuing to invest in multilateralism and continuing to invest in global health so that we don't lose lives without reason, without cause, and in any other way that might compromise the health and well-being of our people and planet.